Thank you very much for coming this evening. We've been really excited to share our new developments with you and other Cigna news as well. And also, we hope you had a really good time at Vinopolis here in London.
Well, good evening, everybody. Thank you very much indeed for coming along this evening. I know it's a really busy time of year in the industry, and so somebody's left their car alarm on or something. I know it's a really busy time in the industry at the moment, so we do really appreciate you putting the time out to come and hear what we've got to say. We're really excited to have you here today. There's going to be some play as well as a bit of work. So after the presentation, we hope you'll stick around and join us for a tour of the world's wines. We can taste some different grape varieties and wines from different countries. So please do stick around and enjoy that with us. And with that, hopefully, we'll have an enjoyable as well as an informative evening. Clicker. So sticking with the global theme for a moment there, we've got some hopefully interesting news to explain to you about what Cigna's been doing over the last few years to work close with employers as they grow their businesses across the world. In addition, we've been working hard and doing a lot of research. In 2013, we collaborated with YouGov and did a customer and employer needs survey, and we're excited to share with you some of the findings from that. And in addition, from those findings, we've driven actually some innovation that we've been putting together to enhance our dental products and make them relevant for not just 2014, but beyond as well. So back on that global theme, I think probably everybody in this room would consider themselves a global citizen. We all kind of travel abroad regularly, we go on a holiday, we travel with work. Maybe we've got family or friends even, who, some may have fans, it's quite possible, who live in different countries. And we work for international organisations, maybe we've got clients that operate internationally as well. So I think we've all got a perspective of what it means to be global, even though we spend most of our time focused in our local market or our home sort of country, which for most of us here, I guess, is the UK. But at Cigna, we really see ourselves at the forefront of this, particularly from a corporate healthcare perspective. We've recognised for some time now that it's critical to have global capabilities in this market. And actually, as you'll see from our corporate strategy, going global has been right at the centre of it, way back since 2010. We've progressed on this journey now for a reasonable amount of time. We've started to learn how different countries differ from each other. And actually, as some of our customers have started to move into new territories, strangely, they're finding similar challenges. There's competition for great people, there's focus and need to contain costs, not just in healthcare, but all areas of business. And their employees are going on these assignments or relocating, demanding access to the very best healthcare facilities. But, to bring it home, something similar to what we're going to look at tonight, like wine, different countries shouldn't be, we shouldn't assume that one country is the same as another. And like the wines, no doubt we're going to taste this evening. French Chardonnay doesn't look, taste, or smell anything like an Australian Chardonnay. And so it is with healthcare. Clients are moving into new countries and jurisdictions, and they're challenged with cultural, regulatory, and innovation issues in terms of how they design their healthcare plans. And so, to help our customers address this, we've formed Cigna's Global Employer segment. We've knocked down the barriers between all of our historic business lines, whether it be our expats insurance business, our Spanish domestic healthcare business, our UK domestic healthcare business. We've removed the silos, we've aligned the management. So now we've got a truly globally connected organisation. But in the UK, the strategy still very much remains the same as it has done for a number of years now. We're extremely focused on maintaining and growing our corporate medical book, typically focusing on organisations of 150 employees plus. To complement that business, we have skills in employee health and well-being services that are designed to help individuals make the right choices about their lifestyle, change their behaviours, and hopefully helps employers to reshape their corporate employee healthcare risks. And of course, dental. Dental is increasingly becoming a main sort of core product in our organisation, and it is the reason that we've invited you here this evening. So as a reminder, hopefully not an introduction, I thought I'd put up some of our two core dental products. Dentacare is an indemnity insurance product which is got 4 levels of cover, and it's designed to reimburse treatment claims on a per item basis. Our oral healthcare plans, again 4 levels of cover. This is a co-insurance plan which is providing reimbursement on a percentage basis of the overall claim. Now, we know at Cigna that we can't rest on our laurels, and frankly we have to constantly question what we're doing to make sure it's relevant to our customers' needs. As a result of that, we invest heavily in research, and we've, as I said earlier, spent a lot of time over 2013 working with YouGov to understand the needs of customers, both on an individual basis and also on a corporate level. Now, we did this also a few years ago, particularly with a focus on dental. We found that the main barrier for people accessing dental care was affordability. About a third of respondents to the survey said that they weren't visiting the dentist on a regular basis purely because of the cost. And 15% of them admitted through the survey that they'd taken extended periods of unplanned leave to tackle remedial dental issues. And so I think, hopefully, most of the people in the room will remember 2012 we launched our full cover feature. This was an initiative designed for our members that take the indemnity product, the dental care level 3 and 4, to give them access to London dentists where they could guarantee to have no shortfall. In other words, their cover was going to be, their plan would be paid in full, provided the treatment was eligible. This was the first to the market at the time. We've now evolved that product, and we've introduced a helpline that will allow employees to call up and find out where their nearest full cover dentist is, and also actually go on and book that dental visit. So when we revisited the research in 2013, we looked at the results by customer and also by corporate client. And, perhaps unsurprisingly, the main theme still coming through is that affordability continues to be an issue. Again, 25% of respondents saying that they haven't been to the dentist regularly purely because of cost. Half of them actually said they would go to the dentist if their employer bought them a private dental plan. I guess, that's obvious, but a third of those also saying that if their company did invest in that dental plan for them, it would make them feel a lot more positive about their employer. Interestingly, also 50% wanted to be able to go to see the dentist outside of traditional working hours, which was a bit of a surprise for us. When we looked at the employer-specific results, 25% of employers are sympathetic to the challenges that people are finding accessing dental care, the cost of dental treatment. And the majority are quite happy for people to take time, pay time away from work to visit the dentist. However, they would like to address that and try and reduce it where they possibly could. And for anybody who's interested in looking at some of this research in more detail, there is a white paper that's available on the desk in the corner of the room. You're free to take a copy of it away with you when you leave tonight. But as a leader of corporate dental care in the UK, we feel it's our obligations to try and continue to do something about these issues. And so, in conjunction with our exclusive partner, Munro Sutton, we're really proud to announce that we'll be launching Healthy Discounts for 2014. Healthy Discounts is available to any Cigna member, irrespective of the plan that they're buying from us or the level of cover. And it gives them a straight-off 20% discount on all treatment costs at that dentist. That's treatment that's covered by our dental plans, or even treatment that's not. So that includes getting your teeth whitened, which a lot of people ask us all the time. So this is another first to the market by Cigna, and we're really proud to be working with Munro Sutton on that basis. And for those of you who are wondering, is it just London? No, it's not. It's nationwide. 265 dentists participating in this. 75% of those will be open outside of working hours during the week, and 40% will be available to treat people on the weekend. So again, Cigna helping employees to find ways around this affordability issue, and employers to address some of the absence concerns that they have with dental care. And we didn't just leave it at that. We've worked again hard at revisiting the shape and scope of our oral health plan, the co-insurance proposition. We've introduced a new 5th level of cover, which is our level 1 plan, which is designed at reimbursing NHS treatment. So again, trying to tackle affordability. We've introduced choice. So when an employer is buying a dental plan, they have scope to be able to choose whether they have a 75% or 100% reimbursement level on preventative treatment. For customers buying levels 2 to 5, we're putting orthodontics for children as standard, and across all of the plans, we're uplifting our oral cancer benefit to £15,000 per year. So, to bring this all together, I think it's clear, everybody will appreciate that regular dental visits improve oral health. And if a population of people has strong oral health, they're less likely to take time away from work. Affordability is still the issue, and so through these innovations, we've worked really hard to try and tackle that, as well as drive down employee absence for employers. So with that, thank you very much for listening. Please do stick around, enjoy the wine tasting. There's Cigna representatives in the room, so if you have any questions, please do ask them, or you can contact us on the details below. But once again, thank you very much for coming, and have a good evening.
It's been great to see such a good turnout this evening to help us launch our new dental initiatives. We really hope that you've had as good a time as we have. If you'd like to get in touch to find out more, please do.